Hi everyone, my name is Paul Kingpriest. So I'm making this video particularly for the medical students in our mentorship group for Global Health Research Lab Online. But I believe that this material should benefit anyone that's interested or that is working on qualitative research. So this particular episode, I'm talking about how to prepare your qualitative transcript for analysis. So you've done your qualitative, that's interview, workshop, or whatever. Now you want to turn it into you've had like the draft transcript. Now you want to prepare that transcript for analysis. What are the things that you need to get done? So that's what I'll be talking about. Now, this kind of video has become necessary because, like initially, way back, usually you record your whether interview or your qualitative in-depth interview, focus group discussion or workshop. You have the recording on a recorder or like an audio device, and then you transcribe it. And this used to be manual, but later on, then you have like transcribers, and then now what we have is like AI devices. So whether your meeting is recorded on Google Meet or Zoom or even for like in-person meetings, usually you have like softwares that can help you turn that into transcript. Now the thing is, because these softwares and tools are not perfect, you need to now ensure that you reconcile your recording with what you actually want to get, what you want to use for analysis. So how do you go from just that first draft to having like quality data, quality transcript for analysis that is ready for analysis? So that's what this video is all about. So, and this is important because you want to ensure completeness of to ensure that whatever is said is actually captured correctly. You also want to improve the quality of your data in terms of readability, and then you want to ensure confidentiality, take out anything that like personally identify information for ethics sake. So I'll explain this in three stages. One is the review, second is cleaning, and third is anonymization. So in the first stage, which is the review, the safest thing and wise thing to do is to have your draft transcript, which is the AI generated content, and then play it alongside the audio or line by line, and to ensure that whatever is said is captured. Now, this is very important because sometimes, due to accent and other things, connection, the AI picks the wrong thing, and you have to ensure that what is said is what it has been captured. Now, if you did not do this, it might run into trouble. I remember for an instance, there was a time that we were working on a particular qualitative data, and the person said dengue virus. Meanwhile, the AI took it as the gay virus. Now, that is something, if you did not read through everything line by line and correct that, that can be very controversial. So, you need to do that just so that you ensure accuracy and you don't want to run into any trouble with that. So you have to confirm that the spoken content is captured perfectly. So if you notice any misheard things, like or dengue for the gay virus, you want to correct it to dengue virus. And then, like for instance, because medical technologies and health related terms sometimes are not like everyday English, so you want to ensure that that is also captured correctly, and ensure that the right speech is attributed to the right person, because these mistakes can also happen with these softwares. Now, it might happen that you get some section of the audio that are completely inaudible or that are inaudible. You want to tag it. So, the appropriate thing at the start probably will be to try to hear it over and over again, because, like I said, accent might be a concern, and you might not be able to you might not understand someone's accent, and someone that is familiar with that accent might actually be able to pick out what they've said. So, you want to also share with somebody else to listen, get someone else or consult them to listen to it. And if you can still access the original speaker, you might want to ask them again. But if at the end of the day you are still unable to get to the end of it, then you clearly mark that section as inaudible. And it is good for you to include a timestamp in the inaudible section so that people will know that this section from here to here is not clear. Do not try to fabricate or come up with context to fill that space. And if at any part is inaudible, just leave it as it is. Ensure that you just tag it properly. So, like I said, the goal of the first stage is to ensure you have completeness of your data. Everything that is said is captured appropriately. Now, the second stage is the cleaning. How do you clean up your transcripts to or become quality data? How do you improve the quality of this data? So now, because when people are talking, it's different from uh, transcript. So filler words like or you want to take them out. Mannerism also affect how people talk. So all of those things you want to remove it to ensure that your transcript reads normally, reads sensibly. So take out any part that did not make sense, some repeated words, sections that have been separated, all of that, you bring them together. Some places is timestamp, some places is just like somebody else's interruption that has been captured. So you want to ensure that they read as sensible sentences. So that is the aim of this cleaning bit. So for this one, you don't ensure that you don't change the meaning of sentences or words. Still maintain the integrity of what the person is saying. Keep what the person is saying. So keep the intended message. Do not over edit or kind of in the process of trying to do this cleaning, uh, take them out of context. I'll give you an example here. I've used a pseudonym for this person, James. So you can see that James here started talking, and then there is a section where you see so all this you have to take out this when and when James is talking, all this yeah, you take them out, and then you take out like this repeated word. You can see this, that's my. You take that those repeated words, you take them out. And then if you notice that this is James talking in the first paragraph, and then this global research lab online came in and broke the person's talk with oh yeah. So you remove the oh yeah so that whatever James is saying can continue smoothly. Sometimes it's actually in between sentence that you see this kind of interruption. So you take it out so that whatever the person is saying continues smoothly. You can see even this third section is still James talking. So you can remove this timestamp as well so that James conversation will run smoothly as a whole section. So that is what you need to do with cleaning. At the last stage of preparing this your draft, this your manuscript, this transcript for analysis is anonymization. So this is generally required or should be done when you want to make the data public, also because of data protection regulation and ethical processes. It is good practice to actually anonymize your transcript. Now, how do you do this? At the start of that, what you want to do is that you want to ensure that for each participant, you assign unique codes or identifiers. So if there are like 10 participants, you might want to do like P1 to P10, PA to PJ, or you might want to use identifier just as you can choose whichever identifiers you want to use, but just ensure that that is consistent. So once you assign that, you have like maybe a spreadsheet or something, another document where you keep that identifier, and then you will now correct it across all your transcripts. Now it's not just names that you want to change. There are also other things like location, maybe location of a hospital and all of that that you might want to take out, so that uh, that person's location is not identified. So there are many things that constitute personally identified information but the ones that are sensitive for your context, for your entire particular project, you want to take it out. I'll give you an example here. So you can see before Dr. James works at Lagos University Hospital, that has been replaced with after participant P3 works at a tertiary uh, level hospital. You can even say in Lagos, but you see that that location will generalize it. For if you want to say some social person, while the person was at King Faisal Hospital in Kigali, you can just say why this person was at a private tertiary facility, hospital facility in Kigali. Now, because there are likely are many of them, so they will not be able to figure out which one exactly, and that protect uh, the person. So now, just to bring everything together, when you do go through this process with your transcript, you actually familiarize yourself with the data, and that helps you to even prepare for like the next stage, which you have had a well review, clean and anonymized data that you now want to use for analysis. So that data is the knowledge that you've gotten from going through this process will help you with your coding and your thematic analysis because you familiarize yourself with the data. So even though you are doing, these processes for other reasons, it actually has helped you in another way because otherwise you still have to familiarize with the data. So the key take home here is that uh, when you have an AI generated transcript, you should go through it to ensure that you review it, that it's complete, you clean it so that it is sensible and readable and makes perfect sense. And then you might also need to anonymize your data. So thank you very much. I'll stop here.